Welcome back to TV5 News at 9, everyone. Mastering your health care can be a challenge, but joining us this morning to share some simple changes for a healthier you, we have Angela Williams from Great Lakes Bay Health Centers. It's good to see you.
Good to see you, as always.
I know, it's so good. All right, Angela, let's get started. We know life gets busy. It's tempting to put off that visit to your doctor if you're feeling fine. So preventative health is one of the biggest reasons why you should never skip your annual checkup with your healthcare provider. Tell us the importance of that.
Well, first of all, early detection. You can be walking around and think that you're fine and not realize something is wrong. And so those annual screenings are so important, not just for you and I, our children, our grandmothers, our extended family, and our friends. So sometimes people take it for granted that, okay, I saw the doctor 3 years ago. No, that's not acceptable at all.
I'm sure something has happened in those 3 years.
Yes, for sure.
All right, so what types of myths do people state about their health?
Well, I'm good.
Yeah.
I saw my doctor, and I've been having this headache, but it's nothing. It's not a big deal.
Yeah, whatever.
So I don't need to go. I'm good. It's just a simple headache. A headache could lead to more serious healthcare issues if it's not assessed by a medical provider.
All right, let's get into some of the general health conditions that many people could possibly have that go unnoticed.
Well, the most common and the most serious is diabetes and hypertension or high blood pressure, along with cancer. If you have a family history of cancer or high blood pressure, it's important that you get checked. People are still dying from high blood pressure, heart disease, diabetes, because if it's uncontrolled and not managed, then it leads to other serious illnesses. Perfect example of his family history diseases could be breast cancer. If there's a genetic history or hereditary genes in your system, it's important that you get checked. And early detection, again, can improve your lifestyle and extend your life.
Yeah, just make it better.
Yeah.
All right, so what are some benefits to seeing your healthcare provider on a regular basis, maybe especially if you've been diagnosed with like an acute illness?
Well, I'll give you an example.
Okay.
Suppose that I was trying to be industrious and I accidentally get stuck with a rusty nail. That's an acute emergency. I go to the ER, I get treated, antibiotics, and hopefully the wound will heal. But at the same time, if I'm noticing that something is happening to my hand where it was injured, I should go for follow-up. Same for chronic illnesses. Again, going back to diabetes. Diabetes can be managed and controlled. We see the commercials on TV. There is so much new medical technology for management, changing lifestyles, and becoming educated. We always talk on this show about how important it is to have those serious conversations with your medical provider. Ask the questions. Don't leave that office without a lack of understanding.
And that always helps to be informed.
Yes.
All right, so what other healthcare measures should you be prepared to discuss with your healthcare provider?
Well, not only just that annual checkup with the physical part of your health, but your emotional being. And if you're having some struggles related to stress, anxiety, depression, don't be embarrassed. We all have challenges. We have challenges. Great Lakes Bay Health Centers, we offer all types of resources to help you navigate that system for support for your mental health. If you're struggling financially with trying to find food for your family, we have community health workers who can support you and make referrals for appropriate resources to help you in our communities.
Very good. And you mentioned, physical health. Having good physical health improves your emotional well-being. Can you lay out some steps that we could do that to make it better?
Well, in terms of first disclosing to your primary care provider is changing lifestyles. Nutrition. Now that the sun is out, we should appreciate that opportunity to just get sunshine, do some walking, changing our nutritional habits, our lifestyle habits, reducing our smoking, ingestion of alcohol, and taking care of our other family members so that we all live a healthy lifestyle.
Absolutely.
Yep.
All right. Any other comments you want to share today?
Yes, I need to remind everyone that Great Lakes Bay Health Centers is always taking new patients. Whether you are insured, underinsured, or no insurance, we still do not deny services to anyone based upon your ability to pay. We can help you in terms of registering for health care insurance plans, as well as take care of not only your physical and mental health, but reminding the community that we have vision services, dental services. If you're pregnant, we have a series of services that support you and your unborn child. And again, we embrace everyone. And don't forget, my final words are always related to the importance of getting those vaccines. I just saw in the news yesterday that there have been measles outbreaks in Michigan. Children need to be vaccinated against measles. Measles is a serious disease that we should be cognizant of the importance of our children and adults, making sure that you get your vaccines for flu, COVID, RSV, and all of the childhood vaccines that are recommended at early ages.
Perfect. Lots to consider and go over. I can't wait to get out for a walk in the sun and improve my emotional well-being.
Yes.
All right, Angela, we appreciate you coming on.
Thank you so much.
It's always a pleasure. And you can find more information on this topic by going to our hot link section on our website, WNEM.com.